Hey, welcome back, everybody. It's time again for another episode of Health Talks with Dr. Trinh. The one show, the only show showing you to the future of future healthcare. And today, well, we got a returning guest. We're back to the future here with NousLogic. Welcome, Dr. Trinh and his guest. Hey, guys.
Hey.
Hello, Dr. Trinh.
Good to see you guys again. Welcome back, and Huang, founder of NousLogic, telehealth. And we want to talk a little bit about what we've been talking about in our series here. This is like our third series with NousLogic. And we have talked about remote patient monitoring and wellness and things of that sort, applying technology to monitor patients at home. But I think one of the things that's been developing in the last few years is this concept of certain conditions that require hospitalization, maybe pneumonia or maybe, cellulitis or infection. And the concept of can this be taken care of at home? Can you bring the hospital to the patient's home, as opposed to having the patient sit in the hospital all day for their IV antibiotics and things of that sort? And I know NousLogic is in this space, and they are developing a process with their technology for a hospital at home. Is that about right?
Yes, Dr. Trinh, yes.
So what does that look like? What an intriguing idea. I don't have to stay in the hospital, which costs me and the insurance carrier a lot of money. I don't have to sit there in bed waiting all day for something to happen, which only makes me weaker and more susceptible to getting sick somehow. I'm sorry to say it, but I always feel like going to the hospital, my chance of getting sick goes up because everybody's sick and I'm just sitting there most of the time. Somehow it seems like I'd rather be home, but I can't be. So what does it look like to bring the hospital to my house? What does that entail?
Okay, I'm glad to share all that with you guys. Okay, Dr. Trinh, could you put on the very first slide that I texted you?
Let me share the thing with him here. Hang on one second. We didn't set this up right. So
my laptop acted up, so unfortunately I cannot share the screen.
That's okay. I'll share screen.
Okay, hang on.
Paul's going to get me hosting ability, and then I will share the screen of what hospital at home looks like. It's a very interesting concept. I mean, no one's even thought about it in the last, 5 years ago, I didn't think about it. But lately, I'm starting to see some media attention and some chats about the ability to do hospital at home, which is interesting.
I think you got the co-host, so there you go.
Yep. Okay.
All right. Can you guys see my screen here?
Yes.
No, I don't know if it's showing up in the video for some reason. So let me try one thing here. Just keep talking for a second. Let me take out.
Yeah, just share your own screen.
So you still don't see it, Paul?
I'm going to reset it here. So everybody hang on. We're making the sausage on the fly here.
Yeah, while
we're good at that.
Yes, I'd like to share a couple of latest news here. Yes, this is very new emerging technology. Actually, starting last year, Mayo Clinic and Kaiser Permanente have teamed up and started funding such technologies with a company called Medically Home on the East Coast. Okay, and we have been working on this for a while. The transitioning from the simple things like remote patient monitoring, which is under our program called, actually our logo called WFH, Wellness from Home. And I coined that from COVID-19. Everybody's familiar with what WFH stands for, which is work from home.
Right.
Okay. So we trademark WFH as Wellness from Home to allow patients to not having to go to the doctor's office, but still having their health status monitored in real time. But that's for simple things.
Now the screen's still kind of small. The screen's still kind of small here, so I'm looking. I see it now. Connective health technology, delivering home solutions for wellness, et cetera, et cetera. What you got your device at the center. What are all those spokes of the
Okay.
wheel? What are
This
those?
is I'm in a business partnership program with LG, and this is the slide that I had a talk with LG yesterday. And interestingly enough, with Arabian on that call, Dr. Trinh.
There you go.
Yes, it's very,
And
very
we're talking about
productive.
LG, the giant electronics super giant that makes TVs and monitors and all sorts of electronic gear.
Exactly. They are starting to invest in 5 new emerging technologies. One is in connected health, of which Hospital at Home is a part of. The second one is the metaverse. Another one is the green energy for electric vehicles. And another one is on smart home lifestyle, which interestingly enough, I will share some of those in this presentation, because without a smart home capabilities and technologies, Hospital at Home is not feasible. Okay.
All right,
And
so
the
lots
last
of buzzwords there. Let's see if we can break them down a little bit here. Walk through this slide. What are the spokes that feed into this device?
Okay. The key things on the title of this slide are wellness, acute care, and smart lifestyle services. Okay. First, we start with, for example, Rpa and Patient Monitoring, which is a Medicare reimbursable program starting in 2019 for simple things, for preventive medicine and to transmit your blood pressure or glucose or your weight to the doctor's office or to medical centers.
And that's what that
second,
square box is in the middle there. That's a small device.
Okay.
Yeah.
That's we call that a smart wellness from home hub, which is part of this platform. Okay, it sits there monitoring activities around it and transmit to the doctor's office or hospitals in real time. Okay,
and again, I'm just going to stop. I just want to stop you a little bit so that everybody's can clear in this. They may not have heard the previous thing. So it's a box. It's like what, the size of a small book or something. It's plugged in,
yes,
and it connects either to your home Wi-Fi or to a cellular network if you don't have Wi-Fi. Is that correct?
Exactly, right. Exactly. And then it has Bluetooth to interface to neighboring health devices and also wearables. Okay. And it
things
also
you can
has
put on your wrist,
things
you can put on your finger, things you can do various things to measure your blood, your oxygen, all the kind of stuff that you'd go to the doctor normally to get. You can have all these devices at home. They connect to this via Bluetooth, and this device connects to your doctor's office over the internet, either using a cell phone technology if you don't have Wi-Fi, or over your home Wi-Fi system.
Exactly. Yes. And besides Wi-Fi, cellular, and Bluetooth, it also supports NFC, which is near field communications built onto most smartphones. For example, you go to Starbucks, at the cashier, you just swipe your phone,
right? And
your credit card is charged, and that is NFC. NFC is used here for quite a few applications. First, it's used for medication tracking. Okay, I'll talk about that later. And then second, it can be, you can swipe an NFC card, which is shown in red at the lower right corner, and then ask for a request for a Zoom video call to the doctors or to your even family members. Okay, and it's very interesting.
I'm sorry, I'm going to break you up a while just to make sure we understand all this. So this little card, it's a physical card. You swipe it like you would your cell phone or something. And when you swipe it on this device is using near-field technology, it sends a request to the doctor. Hey, we need to talk to you right now via Zoom. And the application I remember was, this is an emergency responder. They find you laying unconscious.
That's the third one. No, we're not talking about that yet. This is just for, yes. The neat thing is nobody has to create a Zoom link using an app or a Zoom app or Zoom dashboard. Okay, just swipe. Automatically behind the scene, our cloud services will create such a Zoom link, and the doctors will call back at this.
And that's on the little box. There's on that little video screen in there. I get to see the doctor on this little hub that you have here.
Right.
Okay.
Exactly. Yeah. Currently, it's a tiny screen, so that's not very user friendly. However, that's one of the feature that I'm proposing to LG being in their business partnership is to project that onto their large screen LG TV. And hopefully, in some future time, if they have such a screen on the smart refrigerator, that can be done as well.
Yeah. So stop.
So that's part of the smart lifestyle in the title that I mentioned earlier.
So stop and look at that for a second, Dr. Trinh. I don't know if you've seen these, but my son-in-law, who's into all this stuff, they have on their LG refrigerator, that's the brand they own.
No, that's Samsung. I think that's Samsung.
Oh, it might be Samsung, but I thought it was an LG. But whatever it is, they have a giant, looks like a giant iPad built into the door of their refrigerator. And it shows the time, it plays music. I guess it plays movies if you want to sit in front of the refrigerator and watch something. But they use it for information, and it could be also a Zoom call. So I'm sitting in the kitchen. This device, he's saying, could project what's ever on that little screen on the hub onto a bigger screen, even the one on your TV. I mean, on your refrigerator. Think about that, Dr. Trinh.
Yep. It's convenience.
Yeah, it's convenient.
Amazing.
It really is. Everywhere.
It's like casting.
And that opens up to a slew of new services that is possible on a large screen. Okay.
Yeah.
So not just for Zoom video call, a lot of services, which I'll talk about later once you have even smarter services like infusion pump and smart infusion pump in the home.
Wow. Okay.
Okay.
All right. So carry on. We got a hub, and we got, what was the one in the upper right-hand corner? What's that? I can't quite make out what these are here.
All those are smart medication tracking. But before I went to that, you asked whether in emergency situation, this NFC can be used as well. Yes. Imagine the patient fainted or collapsed, and the first responder team came, and they can just tap onto the card. They can first of all get all the histories of the medication or medical history of the patient. Right. Okay. And also call the doctors, the family doctor of the patient. Okay. So
you say that so casually. I can't imagine nothing like that happens right now. Somebody comes into my house and I've collapsed. They call 911, they call the fire department, they call somebody, and they come breaking into my house here. And there I am on the floor unconscious. They don't know anything about me. And so immediately they've got to start figuring out what's the problem and has he got an allergy? Is he on some medication? All these kind of questions. And maybe there's a family member to tell them there, maybe there's not. But you're saying if they find this little card, this would be what, in my wallet or something here? Right. They look and find this card. All they have to do is swipe. They say, oh, he's got one of those things. They swipe it in front of it. Instantly, all my data comes up for them to read as they're trying to, the paramedics are trying to communicate back. Okay, we've seen now he's this and he's this and he's this. He's got these problems. And they can actually get the doctor on that little device and maybe someday project it onto a bigger TV.
Exactly. Those are all possible. And we have those features supported now.
That's revolutionary.
And for HIPAA reason, if the patient is still conscious, then and the first responder team, when they tap onto this card via NFC, it will pop up on the paramedics, the info. But before he can access the info, the patient has to read to him the password, okay, for HIPAA requirement. Right. Okay. In case the patient fainted or collapsed, then when the paramedics scan this, immediately on the patient's phone, we sense that, and we pop up a display showing the passcode for the HIPAA, for the responder team to use that, okay? So yes, it's a bit inconvenient, but HIPAA requires that the passcode has to be provided before the first responder team can access.
So let me re-emphasize that. So if the emergency EMT medical technician comes racing in, finds you somewhere, or you're at the side of we'll go the other way, you're not even at home, you're in a car crash, God forbid.
Yes.
You're on the side of the freeway somewhere, you're on the side of a road somewhere, there's nobody around, and they come up there, they find this card, and they're trained enough to know, oh, he's got one of these things, let's scan it. they would then be able to access my records. And if I'm unconscious, your device says he's unconscious. He can't answer the question, the password. Here, Mr. or Mrs. Emergency Responder, here's the passcode. Here's how you can get in. Because otherwise HIPAA would stop this whole thing. You're supposed to protect the Health Protection Act, or whatever all this stands for, gives you control over your health information. But if you can't, aren't conscious, this will give them a way around it and into it with your permission.
Yep.
Wow.
But for video call with the caregiver or the doctor of the patient, then that is just a tap, and you can request such call without the HIPAA password.
Every senior
Only for
citizen,
medication history or medical history of the patient.
every senior citizen, like my late aunt and mother and dad and everybody, we were all afraid of them falling. They're all alone. And many of the time, the fire department had to break in because I couldn't get my aunt, or the police, and they broke the door down. They broke the lock of her apartment simply to get in and see if she was okay, or to get her up off the floor. This would have given them instant access to her records and instant access to the doctor if they were available. Fantastic. Unbelievable.
What's on, should we go to the next slide?
No, before that, Paul had asked about on the upper half of the slide.
Yeah.
We're not just monitoring health parameters like glucose, blood pressure, all that, but also we monitor the intake, medication intake, for example. So we have smart pill bottle, and the on the right is the smart pill, the 7-day pill box. Okay.
And how does that work? How do I know? How does this device know if I'm taking my medication?
Yeah, for the smart pill bottle, we have a Bluetooth chip under the cap of the bottle. The moment you open it, the smart hub at the center can detect such event. Okay, but we are also working on a smarter version of the smart pill bottle. It has a weight sensor, so it knows exactly how many pills are being taken.
Wow.
Okay, on the right is a 7-day pill box, which is more common for elderly people.
Sure.
They take more medication per day. Here, it's not practical to have a Bluetooth chip for each of the 28 bins of the 7-day box. So instead, each one will have an NFC tag, okay, like on the smart card down below. And each time the patient removes it from the box and then open it, he or she will have to do an extra step. He scan it onto the smart hub, which has an NFC reader. That way, if he pull out the wrong day at wrong time, we can notify him. And the fact that he swipe it, then we know which bin has been opened, and hopefully they will take the medication to.
So let me insert a personal story again. So as I talked about many times, mom, dad, aunt, all eventually died. All eventually got to a point where they needed to be in assisted living or a complete, nursing home. And one of the things that they charge you for in these assisted living facilities is drug medication monitoring. As people get older, they get confused. I forget which pill to take. I reach in the wrong bottle. I reach in the wrong bin. So you pay them a lot to have the nurse give them the pills and pick it out, which is insane. There's got to be a better way to monitor what your old parents are doing without having to pay somebody to stand there and say, here's your pill, take it.
Yeah. And it's even better because if they pull out the wrong bin at the wrong time, then the smart hub will beep and display that which day they are supposed to and which time the bin they are supposed to remove instead. Okay, and all these events are logged automatically in our cloud server. Instead of having the nurse being there and then jot down on her notes and nobody will look at that.
Right.
So time consuming. Everything is automatically logged behind the scene. And then it can be correlated This is where the analytics and AI will come in. It can be correlated with all the health status being monitored and logged as well during that day. For example, if without medication tracking, and the doctor received that a notification that the patient's blood pressure or glucose is high today. They don't know whether it's an underlying health problem or the just simple fact that the patients were not medication compliant. Overdose, underdose, and things like that.
All right. So far, this is everything we heard the last time. You can measure the pills.
Exactly.
You can measure the weight and the glucose and all these other wearables that you put on to measure your heart rate and your oxygen rate and all these other things that you can measure. How does this? What's the next step to turn this into a hospital at home?
Okay, so remember those three keywords earlier. Wellness, in the title, we show wellness. So that's what we have covered in the previous two sessions, okay? Now we're transitioning to acute care, okay? To allow, for example, early discharge of after post-surgery patients. Okay, and that we need more and more sophisticated monitoring and devices. Okay, for example, medication intake monitoring with smart pill bottle and 7-day pill baths. Those are simple devices. Now, another form of medication intake monitoring is, for example, a smart infusion pump or IV antibiotic. Okay? That opens a whole slew of new services. So now we can talk about hospital at home. Dr. Trinh, can you put up the slide that I sent yesterday? Yes. No, this is not the one. Yesterday, I also sent you another file, another presentation. No, not this one.
Let's see.
It's all it looks like a pitch deck here. This has all the kind of data.
Yeah, this is a pitch deck for LG.
So while we're looking for that, are these devices that would connect to your hub, are they available? Is there such thing as a smart infusion pump that would continue to give me some sort of antibiotic drip like I'd get in the hospital here?
Yes. Before answering that, all the devices in the previous block diagram, which is for wellness from home, they are available. Okay. And one thing I did not mention in that is the Nodal wearable sensor for continuous monitoring of your ECG, heart rate, respiration rate, daily activity, temperature, skin temperature, and even fall detection. Okay. Which will become very important for hospital at home. Okay, for patients.
So the basics you can monitor. When I go to the doctor, he measures my heart, he measures my pulse, he measures my oxygen level because they put that little thing in your finger and how much oxygenation are you getting. All of those things can connect to your device through Bluetooth technology today. Same things I go to the doctor, I can now get myself and do and monitor myself from home. But you're saying there's even more sophisticated stuff, an infusion pump.
Right. Okay.
I don't see your email, Antoine.
No, even my text, SMS. Yesterday, I have a file. Sorry. Yeah.
Let me check.
Too many technologies here. We got emails, we got text, we got social media. So while we're doing that, is this feasible? You're making the technology available. But is it feasible to assume that people are going to set up, or that who would set this all up? Does a nurse come in and set all this stuff up for you? Not the simple stuff, but the more sophisticated stuff. Or do I just order these things and they're shipped to my house and I can set them all up, or my family member, I'm sick, I just got out of the hospital, I can't figure this out. Who sets this all up for me?
Yeah, we have scaled this up here in Orange County, in California, and in Texas. And we have scaled to quite a few number of patients. And if it's via cellular, the Smart Hub is cellular, it's really plug and play. Okay, we can mail it to the patient's homes and they just turn it on and it works. With the Wi-Fi option, then there's an instruction sheet, just about, I think, 12 steps. They can do it themselves or their kids can do it themselves to basically to tell the device what the Wi-Fi password at home is. So after that, it's just you just press your blood pressure device, the start button, the same way as you commonly do, and then the smart hub will pick up that event, the start signal, and then just.
I feel confident that I could do the basics, but you start talking about infusion pumps or other sophisticated things.
Yes.
Does that require a visiting nurse to come out one time and set all this up and show me how to use it, somebody how to use it?
Yes and no. Basically, this is very interesting. Our usage model is that this is still in the work, but
right.
The moment the doctor prescribes some IV antibiotics or some type of medication fluid, then that prescription via a form of a QR code or a certain code,
right?
Yes, okay, will be sent to the pharmacy. The pharmacy will get that ready and deliver it to the patient's home, okay? And at the patient side, the smart infusion pump via the IoT, via internet, will program exactly the rate at which, and what type of medication, of course, and the rate and the volume of the medication that's supposed to be infused into the patient's body. Okay. Yes, the nurse still have to come to the patient's home once to insert needle and all that.
Right.
But after that, unlike the current model, she won't have to wait there until the IV bag is empty. All of that can be monitored remotely in real time at the doctor's or the nurse's office. Okay. So before I talk about specifically about infusion pump and IV antibiotics, the next gen. Okay. I like to say that it's just another form of monitoring of medication intake, like the smart pill bottle or smart pill box earlier.
Right.
But now it's in a liquid form. Okay. But
there we go. We had trouble getting it back up, but it's up on the screen now. Sorry we're doing this on the fly, folks. So thanks for riding along here. We're trying to get all this available. Now we can see it. All right. So I got to stop you one more time because I just want to keep emphasizing these points and make sure I understand it. So on the basic, I forgot what term you called it, wellness, measuring your blood pressure, measuring your glucose, even measuring your oxygen, all these simple, that doesn't sound simple, but all that.
Simple and not continuous, meaning only when the patient start the start button on the blood pressure device or the pulse ox, only then the data is transmitted.
Exactly.
Whereas both our ECG wearable sensor and the infusion pump, they are in real time.
So that
you can monitor the flow rate.
So it does, because you're dealing with a drug, the doctor prescribes an antibiotic, let's say. That's the simplest one. You've been through surgery. They want to make sure you don't get an infection. So you've got that continuous drip going into your arm of some kind of antibiotic or any other kind of fluid that needs to come into your body. As typically that's what you're in the hospital for. They rig you up, the little cart comes over, they insert put the line into your blood, into your arm, and you sit there tethered to this device, and it drips something into your body. And at the same time, there's some sort of continuous monitoring, that machine checking your EKG and whatever else it's measuring.
Exactly,
there.
Yes.
And that's all I got to be in the hospital for, so that I can be tethered, so that I can be tied into that drip, feeding me something, and that monitor. You're saying you can do this at home, that the doctor, when he prescribes it, these devices, this medication arrives, and a nurse comes out and sets it up one time and hooks you up, but she doesn't have to sit there all day and monitor it. You monitor it in real time, continuous monitoring of, and even program it to pump in so much, or to, it's not just communicate, it's communicating both ways. It's telling the device what to do, and it's monitoring it continually from a remote location. That's mind-boggling.
Yes. Just like Tesla can do all those things
Just like
at
Tesla,
a much more
exactly.
sophisticated level. this is, yeah, for medical applications.
I'm a giant
these
Tesla
two-
now. I'm a giant iPhone. You're just monitoring me from afar. Yeah.
Right.
I
Yes.
hope you're not an Android. iPhone's much better.
Not an Android. Okay, right. All right. We won't get into the
Right.
differences between Apple and Android here. So now, what happens? Here's another question for you. So I've sat in the hospital many times. My father, mother, aunt are asleep, or maybe even worse, maybe they're in a coma or something here, and we're monitoring. And I sit there and watch this machine going beep, 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 and it's monitoring something, their heart rate, their respiration rate, or whatever these 3 or 4 graphs are going there. I know when it flatlines, we're in trouble and everybody comes running in. So here's my 2 questions. If they flatline, something bad happens, I'm not the assumption is I'm in the hospital. Within 30 seconds, there's a crash cart there. There's a team there. They revive them. They restore them. They get them going. But I'm at home. How do you handle that?
I'm not into cardiac arrest, the monitoring yet. So that is, I think it still has to be in the hospital, at least for my company and some
Right.
of the very early startups in the hospital at home.
Because
Okay.
nobody's going to come
But,
rushing in if it suddenly turns bad. But otherwise, this is for stuff that maybe isn't as critical. I'm not going to have a heart attack. I just need to get some sort of antibiotic drip or something like that, right?
Mhm. I believe it's available as well. However, due to liability and all that and insurance payment for
Yeah.
those cases, at this point, I like to stay away from such.
Yeah, right. Because that's part of why you're monitoring all this stuff. If something goes bad, then they come rushing in and say, "Oh my goodness." Now, assuming that it's not that critical, life-threatening, but it's
Right.
you know, I had an operation on my knee, and I'm not going to have a heart attack, but I need to have some sort of antibiotic drip or some other fluids added in or something, or I've can you even be like a catheter or something? Could it be? No, not catheters to remove stuff. I'm just trying to think of what else do they put into your blood? They put in other sorts of
A catheter to remove stuff. What do you
no,
mean?
I'm getting confused. Catheters. I'm trying to think what else happens in a hospital. They put a catheter in you so you don't have to go to the bathroom.
Yes. I'm glad
Not
you
that.
mentioned about that. In addition to the monitoring medication intake, like IV antibiotics,
Right.
in this slide, later I will talk about urine output monitoring.
That's what I'm getting
Okay.
at. Right. Yeah.
Currently, the nurses every 4 or 8 hours will have to go to the next to the patient's bed to monitor, to measure the volume of the urine that being output during those 4 hours, because they want to monitor the volume of liquid still in the bodies of the patient. Okay?
Absolutely. So one of the things they do is
Yes.
they come change the bag, and they take the old bag and they measure it and see how much
Right.
urine you gave off. Or were you giving any off? Were you giving enough off? Are you giving too much off? Yeah.
Exactly. So it's labor intensive and it's not real time, and it has to be manually logged. Okay. So a byproduct of our smart infusion pump is a urine output monitoring device, which is real time. Like earlier you mentioned the cardiac, the flat line on the monitoring panel at the patient's next to
Right.
the patient's bed. Now we can show the urine flow rate and volume in real time.
In real
To-
time.
to
So that
allow-
catheter they've inserted, which you're peeing into this little tube that goes into a bag, because you can't get up, you're weak, and so they're collecting the urine for you here. They're measuring it as you pee.
We have a number of questions on Facebook here.
I'll bet. Let's go through some of these. Yeah.
So Edna asks, it looks like all the equipment will be available. Who monitors for things like IV infiltration?
Oh, I don't even know what that
If
is.
someone had an IV and it infiltrated. Then we had also questions about who's paying for it. Does Medicare pay for it?
Right.
And there's a question on what is the out-of-pocket costs for the system? Could this be something like a nursing concierge agency can benefit for private paying clients, right? So lots of questions on Facebook, guys.
All right, so
This is still very early, so the technology is there, but step by step we'll get those questions answered. On the business side, I'm sure that it's 1/20th or 1/10th the cost, because hospital, anytime you have to go through the hospitalization, it costs much more. That's exactly why all this emerging hospital at home technology and services. Okay.
clearly it costs a lot of money to be in the hospital. All right, so let's go through, let's break down some of those, see if we can get some answers. So let's start with the money, since we're on the money. Who pays for all this equipment that arrives at your house, this smart infusion pump, this catheter that they install, and then it measures your pee as you're peeing into the bag? Who measures, I mean, who pays for not just the use of that equipment temporarily in your house, but the setup of that equipment in your house? Who pays for all that?
Like I said, this is still very early. For the wellness devices that I mentioned in the previous 2 sessions, yes, I know Medicare pays for it under the RPM, Remote Patient Monitoring program, and now starting this year, the RTM, Remote Therapeutic Management Monitoring program.
So the basics we are paid for, but this more sophisticated hospital at home, that's still to be determined. If how this all works.
I have to ask my friend at the Mayo Clinic, because like I said, starting last year for the first time, they started, they teamed up with Kaiser Permanente and started to
experiment with this, to try
invest in the companies that work in this field. Okay?
All right, so this is a new frontier. It hasn't been figured out yet, but the assumption is somebody pays for it.
I'm sure it has, but I'm too busy on the technology side. Yes.
So, all right, that's one thing. We're still not sure who pays for it, but the assumption is before it goes mainstream, they'll figure out a way, the insurance, the hospital, somebody will pay for this other than the patient. And then maybe there's a concierge service that you pay for to set it up, or maybe that's also covered by Medicare. Maybe there's an out-of-pocket cost for the patient who wants to set this up and come home rather than sit in the hospital, or maybe that gets covered, still to be determined. What was the other question? That Aetna had something technical, another monitoring thing there.
Oh, well, like IV, what if you have the IV infiltrated while you're home?
Well, I don't even know what that means, so explain what that is.
It means, what if the IV that's in your arm giving you IV fluid?
Yeah.
What if it comes out of the vein, right?
Oh. What if it pops out or gets tangled or something?
Tangled, and who fixes it while you're home?
Remotely, we can detect such event, but in that case, yes, a nurse will have to come out, or if you train the family member well enough, then I think they can plug in. Yes, I have been asked this question before, and that's the answer that the nurse gave.
So maybe the nurse doesn't have to sit there all day, but maybe she's on call and close enough that she can come within a reasonable period of time and do that. Or maybe, I mean, because that's what you're paying for to sit in the hospital. You're paying for those something to pump you in, something to pull fluids out of you, to put fluids into you, and to measure this whole thing. That's mostly what you do after a surgery. You sit there for days until you're well enough to go home, and you don't need all this monitoring and fluids and catheter. But that's the whole, seems to me, the whole reason you're in the hospital. And while you are, I know that sounds scary to try and do that at home, and gee, it's going to get tangled and the nurse isn't going to get here fast enough. It seems like there's something to be worked out there. But at the same time, I've sat in the hospital with these loved ones, and it's miserable just sitting there with nothing to do, watching this stuff happen for days. And in the process, people still get sick. Things still happen. Still gets tangled, and they're busy, and there's a problem, or they do the wrong thing. And I mean, this isn't perfect in the hospitals either here yet. It's probably more perfect than at home right now, but it's not it's not without its own downside and risks right now.
Not just that the patients themselves and the family members or the nurses are happy if you have these services at home, but I like to share one interesting story. Even the doctors. I have a doctor friend, an orthopedic surgeon living in Corona Del Mar here, and each day he has to go to Riverside for operating on his patients, like knee and hip replacement, things like that.
Okay.
After COVID, he told me that he was so happy to stay home most of the time, because now, because of COVID, his patients, unlike before, now they are discharged much earlier. to the home, and via FaceTime and simple monitoring, not infusion pump, a smart infusion pump like this. And now he doesn't have to drive to Riverside daily.
Right.
And he told me he could never believe prior to COVID that
and he's probably more effective because he's wasting time driving back and forth to see the patient periodically. Okay. Let me ask you a question, Dr. Trinh. What I think could happen out of this, I haven't heard this yet, but it seems like as we take the hospital, as we remove some of the need to be in the hospital, you still got to go there to do the surgery. We're not going to do the surgery at home. And maybe they monitor you for a short period of time to make sure until you get out of intensive care. But once you're just sitting up in a room and they're just feeding some insulin drip into you, or I don't know, antibiotic into you, and pulling pee out of you, and in the meantime, not really paying much attention to you. You're really just sitting in a room. You go long periods of time with seeing nobody. That could be done at home. And if it is, does that ever lead to the return of the doctor coming to visit you at home like it was when I was a kid? Now the doctor comes to me, the nurse comes to me. I don't have to go to them.
Yes, let's bring back house calls.
Yeah.
And it doesn't have to be the doctor. It can be the nurse practitioner, the physician assistant, the physical therapist. I mean, who really wants to sit in a hospital when you don't have to? If I can be at home, comfortable on the couch or in my bed, and the services can come to me and get the same quality as the hospital,
right?
Why not, right? And as a matter of fact, guess what? It may be even less expensive.
I'm sure it would be.
For the healthcare system, right?
And the big question, which I think Aetna's trying to get at, and it's a good one, can we envision a day when it is just as safe, it is just as effective? I can set it up and do it. That doesn't mean it runs well when somebody's not watching it. That's the theory of being in the hospital. Somebody's there. If the line gets tangled, it gets pulled out, something bad happens, you've got immediate access to a professional to come in and take care of it. Yeah. Here, we've got to figure out that element of it. But assuming you can get over that element, the whole thing sounds appealing to me. I'd much rather recuperate at home. I think I'd recuperate faster. I think I'd get less chance of another infection from being in the hospital. I know that's not supposed to happen, but it does all the time. Seems like you go in the hospital and many patients get worse because they end up getting other secondary infections because all this stuff's floating around the hospital as much as they try and fight it. And they're happier, their mental health is stronger. They're not just laying in bed. My father used to say, and I don't know if that's true, doctor, let me jump into another area. Maybe Aetna would be interested in this. My father used to believe that every day he spent in the hospital, he went laying flat on his back, he went downhill, that his health declined. And so the theory was you got to get them up on their feet as quick as they can. You can't just lay in bed all day. Is that true?
Absolutely true. When you lay in bed all day, you lose muscle, you get blood clots. There's risks of deconditioning by laying in bed all day. So we don't want you in bed all day unless there's a good reason for it. But the whole other thing with hospital at home is that not every condition is appropriate to be at home, right? Clearly. So it depends on your condition. It depends on the acuity, right? I mean, we're not going to have ICU at home.
No.
But if you have a condition that is less, the acuity, the severeness is less, maybe an infection of your foot where you only need IV antibiotics. Right. Why should you lay around the hospital for that? Right. And so, so we need to really just determine the conditions that can be taken care of at home.
And are there any statistics about, maybe this is something hospitals don't want to talk about, and maybe this is just a urban myth, but where you go in for one thing and you end up getting sicker. It happens, you end up catching
control.
Yeah,
absolutely. That's our other product line, infection control. Yeah. We'll talk about that. We have a platform for monitoring whether staff in the hospital are hand hygiene compliant or not, whether they use the sanitizer or not. But that's another topic. Okay, we have only 10 more minutes. I'd like to cover slide number 3. Could you advance this? This is slide 1. Can you advance to slide 3? One more, please. Okay. Yes. So for hospital at home services, I think all of these must be available before we can claim that it's safe and useful. Okay. Before I talked about the second bullet, which is infusion therapeutics pump, all the others, the cardiac for ECG, continuous ECG monitoring, the fall prevention, and the activity monitoring, whether the patients are sitting, moving, lying down, all that are already available in our wearable sensor, which was in the block diagram I shared at the beginning of this show.
Right.
Okay. So that's very, I think, these services that are essential before you can claim that hospital at home.
So you're already in the basic wellness stuff, the basic monitoring stuff, where it's not acute, it's not critical, but it's critically important that I know what my patient, are they moving? Are they taking their pills? Did they fall? I mean, all of these things can be life-threatening too. You know, you're just laying on the ground, passed out, calling for help. There are all sorts of companies, you know, help, I've fallen, come get me. And I experienced all of that. And the fear that the patient has, and the fear that the doctor has, and the fear that the family has, that they're not taking the pill, they are sitting in bed all day, and they have fallen, and something bad has happened, and nobody knows about it, or their vitals have changed, and nobody knows. Now they can know.
Yes, okay. Okay, so the last thing that I'd like to talk about is that the infusion pump. Along, it's not shown here, but along with the urine output monitoring device that I mentioned earlier, even in hospital nowadays, that is not popular at all. I don't think any device has been FDA approved for urine output monitoring. Okay, that solves many problems. First of all, the nurses don't have to go on rounds and measure it. And then jot down somewhere instead of being automatically logged, and it's now in real time. I think it opens new possibilities in medicine, because now we will have the capability to measure measure and ensure in real time that the fluid volume coming in matches the fluid going out. Okay, in real time.
Yeah.
So that's
that seems to be so obvious, and you tell me that. I think of my own experience watching them every couple hours come and change the bag, and then they measure it and try and say, did the volume coming out measure the volume that we pumped in? If not, we got a problem here. And the human error, they've got to write it down manually, and hopefully they didn't transpose the numbers or forget to do something, or I can't read it or whatever. That's one whole aspect of it, of the data in. I'm still worried about the data out. I'm still worried that not Dr. Trinh, because he's a great guy, but all these other doctors out there, there's this data available and nobody's watching it. Nobody's reading it. How do we get the doctors to adopt and use this? And I know they're busy, so it's the physician's assistant, it's the nurse practitioner, someone else down the chain. But how, and maybe it's just they get notified when it's an alert. Oops, something bad's happening here. But how do we get doctors to use this data in real time? Dr. Trinh.
I think software will step in and do that automatically. That's what AI is all about. Currently, because it's delayed, like 4 hours and 8 hours, I don't think any doctors would have the time to analyze it. I think they log it manually, just in case if something serious happened, they have the data to go back and analyze, rather than here being proactive and preventative. You know, the data
I think
correlated,
that's the key, but
both in and out.
But will Dr. Trinh, you're being quiet here. Will your brother and sisters in the profession embrace this and use it to be proactive, to get to problems before they turn into something?
Absolutely. Because this type of monitoring fills the gap that the technology is our eyes and our ears on our patients that we don't see.
Right.
Monitoring their risk for falling, activity monitoring, things of that sort. And so
vitals.
So as long as there's triggers, right? If there is a trigger that
alerts you.
That alerts you on the fact that there's something going on that doesn't look good on your patient, you could react to that quickly and possibly prevent an ER visit. or hospitalization.
And I'll tell you, I'm going to give you my perspective as a patient advocate who sat and fought for his mom, dad, and aunt through the system. I say patient advocates and patients will start to demand this, and doctors who don't do it are going to have to catch up, not just because it's good practice, but because it's a competitive advantage. If I go to a doctor that's going to monitor me, I'm going to pick those doctors over the ones that are just waiting to see me every 6 months and waiting for a report.
Yes. Yes. Good stuff. This is the future, but the future is now.
Yeah. And not without some fears, and not without some who's going to pay, and the liabilities, and who's going to set it up, and how do we take care of emergency situations. Line got crimped, and I can see lots of issues, and we can come up with lots of reasons, no, but there's one overriding reason that this is going to happen one way or another: cost, and better care, hopefully. Yeah.
But whatever the cost is and who pays for it, it cannot be as bad as the current way of doing things in the hospital. It is so costly. And in closing, I'd like to share with you another story that I heard from my cousin who is a pharmacist. Okay, medical safety. He told me just a month ago that one of his patients, a pediatric patient with pulmonary hypertension, 12 years old, kids, and she has to look at the chart and program by herself. And according to him, it's a very complicated chart. To program herself with onto her infusion pump, what rate and what volume and all that. He said that it's very, very tricky and very error prone. Okay, right. So imagine with all this technology, now the infusion pump can be programmed automatically via the internet. The moment the doctors prescribes, the medication, the liquid medication, and the pharmacy receives that, and then get that ready to deliver to the patient's home. And at home, the machine is programmed automatically according to the prescription.
That's amazing, because you're saying there are certain patients that are doing this themselves right now, whether they want it to or not.
No, this is the current way even for pediatric patient. She has to look at a very complicated chart. Okay, many columns, many rows, depend on the scenarios and the type of medication, and read from there the flow rate and the volume and at what time, and then manually program it. Okay.
Because even in serious situations, they can't keep you in the hospital forever. They can't afford to. Medicare won't pay for it. The patients won't put up with it. I mean, there are other things that are less maybe deadly, but you said the foot infection or something. They try and get you out of the hospital as quick as they can anyway right now. And many times you're having to, or somebody comes out to dress the wound and change the bandage and do other sorts of things. All the stuff that used to happen in the hospital. My aunt hated that. She loved she wanted to stay in the hospital because she felt safe in the hospital. Nowadays, the patient, the whoever's paying for it, the government or the insurance carrier, and the doctors and the nurses, they want you out as quick as they can get you. You're there for the acute phase, the operation, and the intensive care. Once they can, they want to release you and remove that, make way for another bed as quick as they can. That's the way it is anyway. So like it or not, this is coming.
Yeah.
It's only a question of how quick and how safe and who's the first to market here. Are there lots of people racing in this space? You say LG's looking to invest in this space. Is this
interesting that you asked? Last year, I made similar presentation to B. Braun. Have you heard of B. Braun Company, the leading company in infusion pump?
Okay, I've seen Braun name on medical devices and stuff.
B. Braun, yes, a leading company in infusion pump. They had a focus group study to discuss what features and what capabilities for the next gen infusion pump. So I was invited to Florida, Tampa Bay, to make this similar presentation of what and how the IoT, Internet of Medical Things specifically, can enable all these capabilities.
And their conclusion was it's coming. Yeah, it's in the pipeline. You're not the first or the only. We're going to see this stuff. What do you say? Take us out, Dr. Trinh. How should we be scared of the future, or should we embrace it? Is Is this empower the patient to get home sooner and to heal at home and to get the doctor faster information? Or is this more somebody monitoring me and Big Brother's watching, and it's more technology that break and I hate it?
This is the next level of healthcare, integration of technology and health for the benefit of our patients. Being able to monitor more closely our health, how we're doing, being able to capture data and information for the purpose of preventing ER visits and hospitalizations. So yes, this is already here, guys. Hospital at home. We'll see more of it within the next few years.
Well, right here, only on your channel do I hear anybody talking about this. It makes so much sense to me, but I see there's definitely some hurdles that have to be overcome. Who pays for it? How do we set it up? What happens if it goes wrong? All these kinds of issues are going to be resolved. And I get the basic monitoring stuff. I'd be all over that right now. The acute stuff, it seems like that's still to be determined, but you're at the forefront of it and the cutting edge of it here. Yeah.
Absolutely. Thanks for coming on, Huang.
Thank you, Paul. Thank you, Dr. Trinh.
What's the next breakthrough that we can expect to hear back from you? When do we hear, what's the next big thing that's going to happen? I know you guys I know you've got some announcements coming.
Give us some secrets that's coming.
Yeah, give us some other time, some other milestones that you're anticipating when this is really going to go to the next level here.
I'm going to repeat what you told Arabian in this session. Next session, we'll spill the beans on what he's going to work on. And I think with the metaverse and medical combined, it's like 1 + 1 is equal to 11.
Right. 1 and 1 isn't 2. It's 1 by 1. It's 11 now instead of 2. That's a good number here. Yeah.
Yeah, that's how it works. Partnership.
All right. I keep trying to get you guys to give us some early indication. All we get is the tease, the protracted tease.
I know the next, Paul, let me spill the beans now.
Okay.
I know the next NousLogic technology.
You do? Okay.
Yes, it's a cryotherapy chamber to freeze yourself for the next 100 years.
And figure it out later. I'll feel better 100 years from now.
We dethaw you in 100 years, and then you'll wake up. And so we're working on that now, maybe at the next talk.
So instead of taking a sleep, just go to bed and sleep it off. I'll sleep off the next 100 years till they've had time to catch up and figure out how to do it.
When you wake up in 100 years, maybe another country will be, maybe it's only one country left standing. Who knows?
Well, who knows what's going to, can you imagine that would be a fascinating show. What will the world look like 100 years? I have trouble figuring out what the world will look like 10 years from now. We used to look way into the future and say, well, maybe someday we'll go to the moon. Maybe something happens. Now it seems like every 6 months, the unimaginable is happening, good and bad. Pandemics and invasions, as well as revolutionary home and health at home systems here. The pace of change is dizzying. And I think that's what scares everybody about all this. And yet we all see the need and the possibilities, and I don't think anything's going to hold it back.
Absolutely.
All right. Well, thanks for coming on. I still wait for the next tease. So are we still anticipating? We promised the world that Arabian Prince would be back. I haven't seen him yet today. Here,
it's coming. It's coming soon.
Okay.
It's coming, but let me get into my cryotherapy chamber right now.
Okay, very good. We'll see you in 100 years. All right, thanks. Thanks, guys, for coming in again.
Thanks, guys.
Sharing the future.
Bye.
Well, there you have it. The future is today. And today and tomorrow you can tune in to what's happening to improve our health for all of us. Might be a little scary, might be a little uncertain. Come here, gather with us as we explore the future of Health Talks with Dr. Trinh. Streaming live from the University of California, Irvine's Beale Applied Innovation Center. Where else would we be coming from? Right here in Orange County's only community radio station, OCTalkRadio.net.